Wide day of action this Saturday, a petition roundup where we are calling on all of our 7,000 statewide volunteers to bring back their petitions, get them notarized so that we can start to prepare for our submission to the Arizona Secretary of State, which will happen on July 3rd. So anyone who has been collecting signatures or still needs to sign can go to our website, ArizonaForAbortionAccess.org, and find a spot to sign, notarize, and return that petition to restore and protect our reproductive freedoms once and for all. Thank you so much, and we will be sticking around for any individual questions. Thank you.
Can you just update us on the numbers, please, the latest signatures that you have?
We haven't given a new update since early April when we announced 500,000, but all along we've said that our goal is around 800,000 signatures, and we are very well on our way there.
Don, any concern now that the border is going to be on the ballot as well, that could sort of undercut the energy or the momentum behind your ballot measure?
You know, we've been out there through all kinds of headlines these last 7-8 months, and Arizonans are very clear about what they've lost in the Dobbs decision and what they want back. I think despite all the other political noise, I have never seen clarity and enthusiasm for a citizens' initiative like I have with the Abortion Access Act. So we will certainly be out there educating, reaching voters, making sure they understand what's on their very long ballot. But we have a lot of confidence that Arizona voters know what they've lost and are clear on how to restore it.
John, you mentioned education, and this is a question for Dr. Liu and Dr. Carroll as well. Dr. Liu, you mentioned that there's lies coming from anti-abortion extremists. I've heard from certain Republican candidates that Democrats want abortion up until and including the day of birth. With regard to those lies and that misinformation or disinformation, what are you most concerned about potentially resonating with voters, or some piece of information that voters might have in their mind that you don't think is accurate from your perspective as an abortion healthcare provider? What specifically are you worried about?
Well, I'm worried that they will hear these lies and they won't know the difference between lies and fact. And that's why a large part of our campaign is really going to be getting the facts out there, making sure that we explain them, that they resonate with people, tell them in ways that they understand, and that we dispel every single lie that is out there.
But specifically, in terms of what are this? I've heard from voters that the Arizona for Abortion Access Act means a massage therapist can administer an abortion.
Okay. Well, there are so many lies that I could spend all morning here dispelling them, but the one that you just mentioned about massage therapists being able to do abortions, as I said in my comments here, the same rules apply. The same laws apply regulating providers who can perform abortions. Our campaign does nothing to change that. The constitutional amendment does nothing to change that. So, as an example, that is a lie because it's not true.
The initiative doesn't say it has to be a physician, though. So it may not be a massage therapist, but what does that mean to not say that it has to be a physician?
It doesn't say anything about it doesn't say anything about the specifics of what type of physician. What it doesn't do is doesn't change the status quo as far as who is able to do those. They are licensed. They are physicians, meaning the massage therapist is probably not a physician, or if they are, they might be able to do that. So it doesn't say anything about that, and by not saying anything, it means that it doesn't change those things. We can't be specific about everything that it doesn't change. But what is the lie is that people are taking this to an extreme and making up lies that aren't true.
Polls show that Arizonans, in fact, the same poll that showed that Arizonans are not for the 1864 law also showed that Arizonans aren't for completely unfettered, unregulated abortion up till 40 weeks. The 15-week law apparently takes care of about 95% of abortions. What would you tell people who are concerned about that other 5% and what actually goes on with the so-called late-term abortion? What happens if a woman, approaches their healthcare, advisor, who doesn't have to be a physician according to the law, and says, "I want an abortion. It's 35 weeks." What would usually happen in that case, in that conversation? If this law passed, it would just be up to them. So what could you tell the public about how does that conversation work? And does the does a physician go ahead and have no problem with the abortion? In that case, is there a communication? How do they deal with this other 5%?
Again, the Arizona Abortion Access Act does not change any medical requirements, licensure, certification, qualification. So none of that is changed or impacted by this constitutional amendment. If an individual patient trusts their provider, then what this does is return that decision making to the patient and their provider. It says what we believe, which is that medical professionals and patients should be the ones making these decisions, not the elected officials in these buildings, not me, not any one of us. So one thing we're not going to do is entertain every fantastical lie that the opposition comes up with. Our measure is one page. We kept it very clean and simple because we have nothing to hide, and because ultimately this does one thing. It returns the decision making to Arizona patients and their providers. So we're not going to we're not going to go into all of the maybe this.
It's just that the 15-week law again takes care of 95% of abortions. This Abortion and Access Act would basically allow people to get the other 5%. So I'm curious, if you could talk a little bit to the public that may feel a little bit squeamish about that other 5%. How do these conversations occur? What actually happens? What is, if this passes, what is going to happen with these other 5%? And is there a conversation that occurs between the medical provider and the patient about whether they should even have the abortion if it's after, say, 30 weeks?
Just as you said, it is a conversation that should happen between the patient and provider. And that is ultimately, I think, what all of us want for our own private healthcare decisions, is for themselves and their provider to be the ones determining what is needed.
One more thing, your question specifically about why don't we just go with a 15-week ban? Even though the number of abortions that occur after 15 weeks is small, they still exist. And we do not want to deprive those women of the same rights. Just an example, because there are so many, I couldn't name them all. If a woman develops a life-threatening complication of pregnancy after 15 weeks, she should be able to, with her family, with her provider, and in this amendment it says the provider helps make this decision in the best interest of the patient. And she decides she and her family decide at that point, even though she's way past 15 weeks, that to save her life, she would like to opt for an abortion, that she can do that. That's why any week ban, any week abortion puts restrictions on that. Ours mainly goes to fetal viability, and then after fetal viability, the best interest of the patient, as determined by an expert provider, is what is done.
Dr. Liu, the 15-week law already provides for if somebody has a medical emergency, then they can get the abortion after 15 weeks. So can you talk a little bit, Dr. Liu, about how does that conversation occur if there's no medical emergency after 15 weeks between the medical provider?
How long after the vote would this take effect if it's passed?
Usually it takes just a few weeks for the census to be done in the state, and then new laws approved on the ballot kick in thereafter. I don't have the specific date, but we're going to let you all get out of the sun, wrap it up from here, and if we have additional questions, you all know where to find me. Thank you.